Yes, done reading?
Yes, I'm done with reading.
Okay. So if you have read and understood, considering it surgical pathology station, please tell me, how would you help patient understand her condition?
As this patient has undergone colonoscopy, and after biopsy, the report states adenocarcinoma with melanosis coli.
Yes.
This adenocarcinoma has been reached till the muscularis layer. I would like to tell this lady about the invasion of the carcinoma, and I would like to classify this carcinoma according to the Duke's classification.
Very good. Right. So according to this
The,
classification, which stage would that be?
she is having, according to uh, T2 M0.
All right, good. All right. Okay. Considering that she has adenocarcinoma, so what is the most common carcinoma occurring or affecting colon?
The most common carcinoma is the adenocarcinoma, which
Yes.
affects the colon.
Define melanosis coli. What do you understand by this term?
Melanosis coli is the disorder of the pigmentation in the colon wall, which is found on colonoscopy. This is a benign condition, and this does not reflect any disease or is not associated with any disease. It most commonly occurs due to the excessive laxative use.
All right. Please define the term adenoma.
Adenoma is the neoplasm of the epithelium related to the glandular pattern.
Right. What might be the risk factors contributing to the formation of adenocarcinoma?
Adenocarcinoma, overall, you need to ask
Yes,
overall
please.
risk factor.
Overall.
There are modifiable risk factors and non-modifiable risk factors.
Okay.
Non-modifiable risk factors are increasing age, family history, genetic issues, and the modifiable factors are hyperlipidemia, hypertension, diabetes, smoking, obesity.
Right. Please tell me the presence of or knowing that the patient has malignancy or the carcinoma. What would you think this could lead to? What that you have to be careful about?
This carcinoma can spread to the distant structures,
Okay. And
we need to be aware of where we need to be. We need to control the condition as this cancer has been spread to the muscularis propria.
thrombus. Can you define the word thrombus?
Thrombus is the formation of blood clot. Formation of blood clot in the coagulation process.
Yes. In response to
In
injury.
response to the injury.
To prevent bleeding. Okay. When a patient has malignancy, then patient is susceptible to have hypercoagulable state. Right. What do you understand by this?
Whenever a patient suffers from a malignancy, the body the body's mechanism of coagulation is disturbed.
Disturbed?
And
Okay. Yes, please continue.
And there is excessive formation of blood clots in the body, which we refer to as hypercoagulable state.
All right. How a thrombus is formed? Please tell me the sequence of events.
A thrombus is formed after a vascular injury,
Okay.
an injury to the endothelium, and after endothelial injury, there is dysfunction of the endothelium and aggregation of platelets, macrophages, and monocytes are there. And after this, there is migration of smooth muscle cells and monocytes, which engulf the lipids. And after that, there is proliferation of smooth muscles,
Not quite.
which lead to the thrombus formation. Proliferation of smooth muscle cells, and uh, and
If you had to differentiate this thrombus, because thrombus causes vascular obstruction as well to some extent. If you had to compare this with the term atherosclerosis, then please tell me what is atherosclerosis and how both of these two conditions differ from one another.
atherosclerosis, thrombus is actually it is acute, an acute injury to the endothelial structure leads to thrombosis, and atherosclerotic plaque is also prone to injure, and there is also formation of thrombus at the plaque surface. The atherosclerotic plaque there can be a hemorrhage into the atherosclerotic plaque, or it can also rupture due to mechanical forces. And after that, there is aggregation of platelets, macrophages, and monocytes.
Can you please tell me the layers of blood vessel from inside to outside? Very
Tunica,
easy. Yes. Tunica, which one?
tunica intima,
Okay.
endothelium. And first of all, there is endothelium, then intima, then there is media and adventitia.
Okay. So there is endothelium, then there is tunica intima, tunica media, and then tunica adventitia. This atherosclerosis takes place or acts at which layer? At what level?
It
And
is
if you
formed
have
at
to
endothelial
yes,
levels.
yes, please. And if you have to compare it with thrombus, that occurs at what level?
Thrombus, actually, formation of thrombus is after the injury to the endothelium.
All right. And
atherosclerotic plaque can involve all the layers.
okay. Thank you.